My name is Gabriel Adade, and this is my presentation over caring for somebody that's Parkinson's disease. So basically, the things that we're learning today is we're going to do an introduction on Parkinson's disease, the key symptoms of Parkinson's disease, the stages of Parkinson's disease, practical tips for caregivers, communication tips for caregivers, and managing non-motor symptoms, safety and prevention, and then we'll have a conclusion, and then the caregiver self-care. So Parkinson's disease is a progressive neurological disorder that's affecting movement. It's caused by degeneration of dopamine producing neurons in the brain. Main symptoms include tumors, stiffness, bradykinesia, which is basically the slowness of movement, and postural instability. And it affects both motor and non-motor functions, including mood and cognition. Parkinson's disease typically occurs in people over 60, but it can affect the younger division. So some key symptoms of Parkinson's disease is motor symptoms. So obviously, like tremors, like shaking, muscle stiffness, slowness of movement, and difficulty with balance. Some non-motor symptoms are depression, sleep disturbances, cognitive changes, which is basically memory problems, and automatic dysfunction and low blood pressure. Symptoms tend to worsen gradually over time, especially with it being due to old age. The progression of symptoms varies from person to person. Early signs may be subtle, like a slight tumor in the hand, or even a change in posture. Okay, so now I'm going to give you some practical tips for some caregivers who are dealing with clients that have Parkinson's disease. So, assist with mobility. Provide walking aids like canes or walkers to support movement and balance, and then encourage exercise. Regularly physical activity, including walking, stretching, can improve flexibility and reduce stiffness. Medication management. Ensure that medications like levodopa are taken as prescribed and on time to manage the symptoms. And then safety measures. Make the home environment fall-proof from any hazards. So basically, you want to remove any hazards to keep the old Alzheimer's patients safe. And then we want to encourage independence. Allow the person to perform tasks as independently as possible, even if it takes longer. You do want to encourage your patients with Alzheimer's to have independence, because like as caregivers, they really do spend a lot of time with these people, and these people aren't spending individual time on their own to actually know how to deal with the disease like outside of the caregivers like vicinity. And communication tips for caregivers: speak loudly and clearly. Parkinson's can affect speech, so ensure clear communication and allow the person to respond. Use simple instructions. Break down tasks into smaller steps. For example, let's stand together, like something saying stuff like let's stand together, rather than just giving long instructions. Break down tasks into simpler steps for them, like okay, I've already made that point. Nonverbal communication. Be patient with and use gestures or visual cues when necessary, and then provide your reassurance. People with Parkinson's disease may become very frustrated with their motor difficulties. Offer encouragement and understanding, and then maintain eye contact. Eye contact helps and reinforce communication and allows and shows attentiveness. So now we're going to talk about managing the motor symptoms. Depression, the non-motor symptoms. My apologies. Depression. Many individuals with Parkinson's disease experience depression. So offer emotional support and encourage seeking therapy or medication if needed. Sleep problems. Create comfortable and relaxing sleep bedtime routine, and maintain caffeine or the stimulating activities before bed. Now, cognitive changes. Encourage activities that stimulate the brain, like puzzles, reading, or social interaction. And then automatic symptoms. Help manage the issues like low blood pressure by encouraging slow position changes and monitoring hydration. So now we're going to talk about safety and fall prevention, because this is a very big issue that they deal with Alzheimer's patients. They really do have a lot of high rates of self-harm just from hazards, just laying around the house, or just any hazardous objects that may be in their environment. So obviously remove tripping hazards, ensure that rugs are secure and pathways are clear of obstacles. Use proper footwear, and encourage a person to wear shoes with non-slip soles. Install grab bars. Place a grab bar in the bathroom, near stairs, or other key areas in the home. Be alert of dizziness, weakness, or unsteady gait, which can lead to falls. And then use mobility aids. Canes, walkers, or even electric scooters are perfect for Alzheimer's patients. And that's going to bring us to our conclusion. Caregiving requires patience and understanding. Always prioritize safety and routine, and support yourself, support others, stay informed, and seek help when needed. Thank you.